My name is Dr. Eric Jablonka. I'm a board-certified plastic and reconstructive surgeon with additional training in reconstructive microsurgery, and I've dedicated my practice to breast reconstruction after breast cancer surgery here at North Beach Plastic Surgery. I completed my undergraduate training at the University of Rochester in upstate New York, where I studied biomedical engineering with a concentration in cell and tissue engineering. After graduating from college, I moved out to Southern California, where I worked in bioindustry for a little bit. I then came back to the East Coast, where I attended the University of Buffalo School of Medicine, where I got my medical degree. After this, I was fortunate enough to match into plastic surgery at the Mount Sinai Hospital in New York City, where it was a combined plastic and reconstructive surgery residency program. After this, I went on to do 2 fellowships. The first fellowship was at the University of Pennsylvania, where I learned reconstructive microsurgery. After this fellowship, I then went to Stanford University, where I completed a fellowship in pediatric and adult craniofacial surgery. After completing my training, I took a job with the University of Pennsylvania, where I was an assistant professor in plastic and reconstructive surgery. I worked in a partnered program, the Virtua Penn Medicine breast cancer program in South Jersey, where I took care of many women with breast cancer, offering the full breadth of reconstructive surgery after, again, breast cancer surgery. One of the reasons why I love what I do is really because I enjoy the community, and it's an honor that they put trust and faith and confidence in our practice, our staff, and our surgical services. It's incredibly rewarding to be able to take care of these patients. So back in May of 2022, we opened up North Beach Plastic Surgery here in Virginia Beach, and one of our main goals was to build a practice that offered the absolute highest level of breast reconstruction care to the breast cancer patients in Hampton Roads. We wanted to make sure that they didn't have access to just implant reconstruction, but also to the newer, cutting-edge perforate or flap reconstruction or tissue-based breast reconstruction. So it was important to us to offer these services to women undergoing either a lumpectomy or a mastectomy for either the treatment or even prevention of breast cancer. A big reason why I enjoy breast reconstructions because it can be quite challenging, particularly with the patients that come to North Beach Plastic Surgery, knowing that we offer other options, particularly tissue-based reconstructive options. Tissue sometimes can be a patient's only option. So we see a lot of patients that have come in with implant reconstructions and they can do fine. Implants can do just fine, but sometimes it's not for everyone. So we see the complicated implant reconstructions where they're just not holding up that well, particularly in patients that maybe needed radiation as part of their treatment, where an implant just doesn't do well in a radiated field, in a radiated chest. At that point, the patients need to turn to tissue if they're looking to restore their breast after breast cancer surgery. These patients can be very challenging, right? To get stable tissue to the chest that looks good, that feels normal. I very much enjoy these challenges. I believe what we offer here at North Beach Plastic Surgery, these surgeries really are a perfect marriage between engineering and artistry.